What new biomarkers improve osteosarcoma treatment? Imagine a future where doctors can predict how osteosarcoma will behave and tailor treatments just for each patient. Recent research is bringing us closer to that goal with new biomarkers that could revolutionize how we fight this bone cancer. These biomarkers are biological clues found in blood, tissue, or cells that tell us more about the tumor's characteristics and how it might respond to treatment. One exciting development involves circular RNAs, or circRNAs. These are a special type of non-coding RNA with a closed-loop structure, which makes them very stable in the body. Scientists have found that certain circRNAs, like H-SACRC000, 1821 and H-SACRC0005721, are often dysregulated in osteosarcoma. These molecules can be detected in both tumor tissue and blood samples, making them promising for early diagnosis. They also help predict how well a patient might respond to treatment by influencing key cancer pathways involved in tumor growth and spread, such as VEGF signaling and cell cycle regulation. This means they could help doctors decide whether to pursue more aggressive therapy or less intensive options. Another promising area is the immune microenvironment. The gene PLEC has been identified as a biomarker that not only predicts prognosis but also plays a role in how immune cells behave within the tumor. PLEC influences macrophages, which are immune cells that can either fight the tumor or help it grow. By understanding and targeting PLEC, researchers hope to improve immunotherapy strategies, making treatments more effective when combined with traditional chemotherapy. Exosomal biomarkers are also gaining attention. Exosomes are tiny vesicles released by osteosarcoma cells that carry proteins and genetic material. These vesicles can promote tumor growth and spread, but they also serve as a source of information. Analyzing the contents of exosomes from blood samples could help detect osteosarcoma early, monitor how the disease progresses, and assess how well treatments are working. This non-invasive approach could lead to more personalized and timely interventions. Proteins linked to metastasis and resistance to chemotherapy are also being studied. For example, high levels of glutathione S-transferase P1 and the chemokine receptor CXCR4 are associated with worse outcomes and a higher chance of the cancer spreading. These proteins could serve as markers to identify patients at higher risk of metastasis and help develop targeted therapies to block these pathways, potentially reducing the chance of relapse and improving survival. While these biomarkers are still being validated through ongoing research and clinical trials, they hold great promise. They could help doctors predict which patients will benefit most from standard treatments and who might need additional or alternative therapies. This approach supports the move toward precision medicine, where treatments are tailored to the individual's tumor biology, potentially leading to better outcomes and fewer side effects. It is important to remember that most of these biomarkers are not yet part of routine clinical practice. Researchers are working hard to confirm their usefulness and safety through rigorous testing. As we learn more, these biological clues could become essential tools in the fight against osteosarcoma, helping to detect the disease earlier, guide treatment choices, and improve survival rates. Always consult healthcare professionals for personalized advice, as each case is unique and requires careful medical evaluation.